Majority of the hematological cancers in children, maybe about 80 to 90% can be cured today.
Hello everyone, welcome to an inspiring episode of our podcast series in conversation with Dr. Radheshyam. Dr. Naik is someone who's truly shaped the landscape of cancer care in India. A pioneer in blood cancer treatment and one of the country's most reputed oncologists, Dr. Naik has guided thousands of patients through some of the toughest moments of their life. Let's dive into the questions, Doctor. Dr. Naik, welcome to our podcast series.
Thank you very much.
So, first question would be, when someone is diagnosed with blood cancer, the first thing they want to know is, can I fully recover? From your experience, what does recovery look like today and the treatments we have?
Majority of the hematological cancers in children, maybe about 80 to 90% can be cured today with or without bone marrow transplantation, because a lot of chemotherapy, a lot of immunotherapies, antibody treatments and targeted treatments are now available. As far as adults are concerned, maybe about 60 to 65% of the patients can be cured, and some more can be cured if bone marrow transplantation is added to these patients. So it is much better now than, say, a decade back.
Speaking of the treatments, could you walk us through the main treatment options available for blood cancer? And more importantly, what does each of the treatment means to a patient and their family?
If you look at majority of the blood cancers, especially in adults, initially when they came, we should give them supportive treatment because they will be anemic or they may be having infection. So we may need to give blood transfusion. We may need to give antibiotics to those people, and they may be having severe pain and other symptoms, so we have to relieve them. So once that is done, we need to treat them with chemotherapy. Usually, most of the treatment will be chemotherapy, but there are some targeted treatments available now for many of the cancers. For example, multiple myeloma, we don't use chemotherapy at all. There are biological agents which have very little side effects. So that is the kind of treatment which is available now. Say about 30 to 40% of the patients with hematological cancers may recur after successful treatment, or they may not respond to the treatment at all, and some of them may be eligible for bone marrow transplantation. And recently we have got CAR T cell therapy, which is another way of immunotherapy. So that treatment also is available.
Doctor, again, bone marrow transplant is often considered one of the most advanced treatments. After the procedure, how long a patient usually needs to stay in the hospital? What does the journey to complete recovery look like once they're back home?
The bone marrow transplantation is two kinds. One is what we call as autologous transplantation, where patient's bone marrow is kept outside. We give high-dose chemotherapy to the patient, give back the marrow. This is an autologous transplantation. This is a simpler kind of transplant and is possible for certain cancers like lymphomas and some of the leukemias and a type of cancer called multiple myeloma and all that. Here, the patient may have to stay in the hospital for approximately 3 to 4 weeks, and once he goes home, most often his immunity will be almost normal.
Okay.
So there is no need for any additional therapies for that. The second kind of transplant is called allogenic transplant, where we actually take the bone marrow from another person who is either related or not related, but HLA matched. So that is given to the patient and transplant is done. Here the patient may have to stay in the hospital for a month only, but he has to be available immediately in case something goes wrong for about 3 months. At least we say that you stay in the city for 3 months, and after that also some of the patients develop chronic graft versus host disease, which is an immune side effect of the transplantation, and we may have to look after them for several months, up to maybe 1 or 2 years also sometimes.
Okay.
So it depends on, but majority of the people will be well within 3 months.